Hello, everyone, and welcome to our presentation around the School-Based Health Alliance's consulting services and how we work with you to better serve students through school-based healthcare. We're so excited to have you here with us today. Today is more of a presentation, which is different than we usually work. We're often very collaborative and conversational, and we'll do a lot of facilitation. But in order to help offset that just a bit, we would like for you to chat in the chat box your name and your state and your role. And as we go through the presentation today, keep those questions coming, any comments that you have or anything you would like to share, and we'll go back and forth as we do this and try to facilitate a conversation through chat and being live. So with that, we do want to share just a bit that we plan to talk about the School-Based Health Alliance's consulting services and how we work with you to strengthen your school-based healthcare efforts to really serve students better. We want you to be able to identify what customizable topical areas that we have around startup, improvement, maybe state leadership or youth development, and more based on what you know you need from your community. With that, we also want you to walk away with a better understanding of how we can work together. So to get us started, for those of you who we may not have had the opportunity to meet, we want to share a bit about who we are. And the School-Based Health Alliance is a DC-based nonprofit that serves as the national voice for school-based healthcare. And the reason I am here and we are here is that we all believe that all children and adolescents deserve to thrive, but many struggle because they lack that equitable access to healthcare services. And school-based healthcare is one of the solutions by bringing healthcare where they spend the majority of their time in school. With that, our focus includes policies, standards, data, and training to support and grow school-based healthcare, and particularly school-based health centers. Whenever we think about our work and trying to explain what that looks like, we often will say when health and education come together, great things happen. Things such as attendance improves, chronic conditions are better managed, acute issues get quick and expert attention, and we all know that healthy students are better learners.
Good morning, everyone. I'm Emily Baldi, and I'm really fortunate to work very closely with Paula on our consulting team. And I know that Paula has a wealth of experience in school-based health centers, and I'm hoping that before we move on, she'll share a little bit about where she has seen that difference really come to life at that health and education intersection.
I would love to, Emily, and that's one of the things that I always say is I'm not an expert. I've been around 20 plus years, almost 30. And what I'm really good at, I laugh and say, is sharing with you what has worked for others so that you know in your community are able to decide what works best there. As a nurse, with those 2+ decades, I remain a fierce advocate for school-based healthcare because I've seen what it makes possible. And one of the funnies I've shared, and if you've been with me before, you may have heard this, but I had a student who come in and said a frog peed in his eye. And he was cleaning out his family pond. And I thought, is he pulling my leg? And I look at him and assessment showed that something really was going on. That pee ended up being a toxin from a parotid gland in that frog or toad. And it was an urgent eye issue. It's the same thing that makes your dog sick if they get a hold of one. And the grandparent couldn't drive for the needed care. And that coordination that happened to get that primary to engage with the primary care provider who told me, yeah, Paula, that's a toxin. Let's get him over and see an eye specialist. And to my own son who needed care when his father and I couldn't get him when they were working. And that's what happens, I think, when we work together, and why you hear me say I've been bitten by the bug, the school-based healthcare bug, and why I see school-based healthcare and school-based health centers and remain that fierce advocate for access to healthcare. All right, so we kind of already set the stage around getting to know you, and I am excited to see all of you popping up in the different roles in the chat box. So please just keep them coming around who you are, your state, and your role.
And I would also say that if you have not yet taken the poll, there are 3 questions to help us learn a little bit more about the work you currently do and the work you're hoping to do. You may need to toggle. So if you can see the chat, you may need to toggle to the poll, but that is also useful information for us as we continue this conversation. In a moment, we're going to talk briefly about school-based healthcare and school-based health centers. And then we'll share a little bit more about our team at the School-Based Health Alliance, the clients with whom we've worked, and our approach to consulting. And then we'll talk a little bit about what the process looks like for exploring work together. And we will make time at the end for questions. But if you have them throughout, please just drop them in the chat and we'll get to them as we're getting through some of this content.
Thank you, Emily. And so far, it looks like the majority, a little over half, are sharing with us that they have a school-based health center with 30 or more hours a week. That's about 58%. And about 31% has some type of services, such as immunization clinics, sports physicals, vision. And the majority of the folks responding are healthcare providers, community-based organizations, followed by school or school district.
That's great, Paula. And then that last question, which asks about their interest in this session, you may have to scroll.
Yeah, the third one. Let's see here. Interest in learning how to support their school-based healthcare in their communities, coming in about 20%. 54% interest in improving an existing school-based health center. And then we have some around startup and planning. They're all about 7 to 10%.
Great. So it seems like a healthy mix, although kind of healthcare heavy and heavy on folks who already have a school-based health center. So some of this information might really be a review for you, but we want to make sure that we're all on the same page about what we mean when we say school-based healthcare and school-based health centers. When we say school-based healthcare, we're talking about a community-based healthcare provider like an FQHC, a hospital, a health department, offering health services to students at school. And we know that this kind of school-based healthcare provided by a community provider works with and doesn't replace existing school health services like school nursing or school counselors, and that it's intended to work with a child's existing primary care provider. So really, school-based healthcare is about complementing and sort of shoring up existing health services in a community. Paula, do you want to talk a little bit more about what this looks like?
Yeah, and I think I want to echo first your really good framing, Emily. We recognize the importance and the essence of existing school health services provided by schools and health professionals, whether they're employed by the school or contracted, such as our nurses, our school nurses and our school counselors. The focus of our work is school-based healthcare partnerships among the community healthcare provider, a school in the community. Sometimes that looks like what we're seeing in the poll responses, that where there's partners for specific services such as vaccine clinic or behavioral health. And at the other end of that school-based health care spectrum is offering those comprehensive medical behavioral health services, what we call a school-based health center. So let's take a look a bit and talk a little bit more. We appreciate and value the research base for school-based health centers, but we also know that school-based health centers isn't always possible when you're first starting. It can be something that you're looking to work to. So there's lots of options for collaborating with partners to better meet those student needs. And as we talk about those school and community partnerships, our question to you is, where can you start and where do you want to go? And by the looks of your feedback, it looks like you've already started and you're figuring out or have figured that out of how to best meet those students.
Thanks, Paula. When we think about, I don't know if spectrum is the right word. When we think about the different ways that these partnerships can look, it might be something that happens infrequently, like a vaccine clinic or a sports physical event as the seasons change. I have attended a couple of presentations this week where folks talked about providing services on mobile units, in particular dental care. I think that's a big one that we hear mobile being used for. Dr. Chris Colheed, who talked yesterday with his colleague Jane Hamilton about starting school-based health centers in rural communities, shared that a trend they are noticing is an increased interest in behavioral health. So if a school approaches them and says, we'd like a school-based health center, very often they're looking specifically for support around behavioral health. And then some of you have shared in the chat that you work in comprehensive school-based health centers that are providing primary care during the time school is in session, and that may also provide services like behavioral health, oral health, vision care, health education, nutrition support. So a pretty wide range of how this can look. And I will say that much of our work focuses on school-based health centers or on teams that are hoping to get to school-based health centers, but we also do some work around strategic planning, about beginning those partnerships. So we'll talk more about all of that in a moment. Paula, anything to add that I've missed here?
No, I don't. Thank you, Emily.
Okay. So now a little bit more about us. As we've shared, we're the national provider of training and technical assistance to the school-based healthcare field. And the big goal that guides our work is improving the health of children and adolescents by supporting the development and maintenance of strong partnerships among schools, communities, and healthcare providers. Our consulting team has more than 300 years of combined experience. I'll talk a little bit more about our crew in a moment. And we use best practice approaches as well as quite a bit of flexibility and responsiveness to meet the needs of the communities with whom we work. I'm trying so hard not to get sucked into the chat because I love to hear about the work that people are doing, but I'll return to it in a moment. So on this slide, you'll see some of the folks on our consulting team. We're also excited to be welcoming some new team members whom you may have met as they moderated sessions this week. But I would guess that if you spoke with someone who had worked with us on a consulting contract before, they would very likely say that they did not work with just one of us. We are collaborative in our approach with clients, and that's the way that we work as a team as well. So often you might interface with Paula or me at the outset as we sort of decide what might make the most sense in your community. And then there will be generally a few of us who will do the work together with you.
Yeah, like today, Laura and Tammy are actually here with us. And yeah.
Yes. We work with teams at all stages, as we said, of school-based healthcare program development. So that might mean clients who are engaging in initial conversations about identifying priorities at the state level. It might mean folks who are in the beginning stages of planning a school-based health center. It might mean an organization that has a fully operational school-based health center and would like some improvement support. On the next slide, you'll see that we work with a range of clients. So we mentioned healthcare at the outset, including federally qualified health centers, hospitals, health departments, academic medical centers. We work with schools and school districts, including increasingly community schools, which is a joy for us. We have worked with universities, philanthropic organizations at the local, regional, and national levels. And we've also worked with state level stakeholders like departments of public health. So this is our clients A through M. And on the next slide, you'll see A through W. We've not worked with a Z client yet. But what I want to emphasize here is that working with this sort of wide range of groups and communities, we provide a wide range of services, startup support, improvement support, support around planning grants, RFPs, strategic planning. We also offer content expertise. I think that a colleague of ours is here who was involved in this work. We have done some learning collaboratives around HPV vaccination in communities. We're doing some food insecurity work now. So much of what Paula and I will share about today is about that startup and improvement and capacity building, but we also are available for some of that more specific primary care behavioral health content expertise.
Thank you, Emily. I've been watching some of the questions in the chat, and I appreciate the peer-to-peer sharing and response to some of the questions. And afterwards, we also will share the slides. And I think Tammy responded to that. So it's hard not to watch the chat, as you said, because I want to see what all you're sharing, and it excites me. But with that, I think you heard Emily mention earlier that as we work with you, it's important for us to tell you that we work from best practices. And what that means is we gathered experts from across the country to discuss school-based health center sustainability. And after reviewing the literature and the tools and the resources and the sharing of those from across the nation's experiences, that work group determined that at the end of the day, sustainability of the framework comes down to three main characteristics: strong partnerships, sound business model, and high quality practice. The three domains of sustainability here are representative as cogs, and similar to machine, if one of these aspects aren't working well to its fullest potential, then it affects the overall program. And these are fundamental to your work, along with school-based health center core competencies. And we're not getting deep in those today, but know that they were developed the same way from real-life peers who have figured out how to make this work in their community. And that's fundamental to the work that we do when we work with you, based on those really those best practices, true and tried from across the nation. So with that, whenever we take a little bit deeper look, and to give you a little bit more of a look at our consulting service, talk about strong partnerships based on these nuts and bolts. What that means is we work to help you identify and develop and nurture partnerships with your schools and community stakeholders, such as looking at the sponsorship organization for your school-based health services and school-based health centers, what your local healthcare providers look like, and working with those student and families and school partners. And I think one of the biggest things I would share here with partnerships is whenever we look at working with you, we encourage a diversity of medical sponsors, but we know that there are pros and cons to different sponsorship types that can have an effect on that sustainability piece. So we will work with you to talk through that and looking at your community, what works best in your area. And with that, I also think it'll be instrumental because the partnerships, when you get further down the road, will really drive your waiting room, and whether that's empty or you have good utilization, because that's very indicative of the partnerships that you've built and the buy-in with that. So just a couple examples of what we've seen and why that first part, and they're not chronological order, I don't mean that, but why partnerships are so important. I often say partnerships is the most important, however.
Thanks, Paula. Before we move on, there's a great question in the chat about how many school-based health centers see only students and staff versus seeing the community as well. Do you want to address that now or wait till the end?
That's a really good question, and I've seen several questions come up that I would normally say, let's look at our census. I'm going to go ahead and put a plug in. We are completing the school-based health center census right now, and if you haven't completed that, please do so, because that's where we get a lot of the more current answers for their questions. But we see both. We see school-based health centers who see students only. Actually, about three. We see those that see students and staff, and we see those that see students, staff, and community. And there is additional work that has to happen around working with the school, ensuring the safety pieces that has to happen there. So there isn't a right or wrong answer. The answer is what works best in your community. I often see the community being served at the smaller schools where the student numbers may not support a full-time school-based health center, but they've become very innovative and have looked at other ways so that they can be there full-time and keep the lights on. So very good questions.
And I think sort of a natural segue into this next goal, right? When we think about these three goals around sustainability that we support communities in working towards, oftentimes one factor in making that decision about whether to serve the community, in addition to questions of safety, confidentiality, practicality, and need, has to do with being able to keep the lights on. So when we think about a sound business model, the big picture is that we hope that all school-based health centers do some financial planning that relies on a diversity of stable and predictable funding sources, maximizing patient revenue, and an appropriate size role of grants in supporting long-term operations. So what does this look like in practice? We think about an analysis of financial standing. So what does it cost to operate the program? What do income and expenses look like? And I think about a really lovely group that we worked with a couple of years ago, a beautiful facility, a school partner who was so committed, so on board, but they had not received guidance at the outset about planning for sustainability. And after a couple of years, the entity that was providing medical services wasn't able to sustain those services. They were not able to bill enough to pay for their providers' time. So not that school-based health centers were hoping for it to be a moneymaker, but that they needed to be able to cover some of their costs and were unable to do it. And so now they have had some conversations about what does the sponsor need in order to be able to keep the lights on there. And so the school has done quite a bit of work on outreach, ensuring that families know they can sign a consent form, those kinds of things. In other communities, we work with the planning team or with an existing team who's just not had the opportunity to do this, to complete a pro forma, which is sort of a detailed budget that allows a team to project. We do 4 years out, what their income and expenses will be. And so a team will provide us with data about what they expect for utilization, insurance reimbursement, provider salaries, and a host of other things. And then we might say, gosh, have you thought about what if you use an NP instead of a physician? Or tell us about why you're using an RN instead of an MA. Or have you thought about doing more outreach on behavioral health services? So really helping folks meet the needs of their community in a way that is going to allow them to provide services in the long term from a financial perspective.
Thank you, Emily. And I think you touched on some of the chat that I'm seeing and the different frameworks and models and staffing that they have chose for where they're at for those who have existing school-based health centers. And for those who haven't, that is one of the areas I think that is really a positive attribute of thinking through all of those. Do you need a pediatric nurse practitioner that can see through 21, or do you plan on seeing the staff and the community? And if so, what does that mean with the staffing and the provider credentials that you look for? And I think it transitions nicely to the third piece around high quality practice. And there are three elements whenever we talk about demonstrating high quality practice that peers from the field identified. And those are measuring quality indicators, effective data extraction and reporting, and routine workflow and data analysis. And I always laugh because this seems really dry, but this is where I get excited. So sometimes I'll say I'm kind of nerdy, but stories are always good whenever we start this work. And one I tell you is about a routine workflow and data analysis. One of the practice tips or pearls that we often share when we're working together is the importance of sharing data with staff, at least monthly, and some of the variables to be sure to include. And being a past director of outpatient clinical services and multiple different physician practices and offices, I would always say, I don't deal with the dirty P. I don't do productivity. What I do is I make sure that the providers and staff have what they need so that they can help do the dance to ensure that the productivity is there to keep the lights on versus us being a pull struggle, stepping on each other's toes. So if the staff are empowered with information on a regular basis, they can do those pivots to ensure that they keep the lights on as long as they know what they're working towards. And I share that because I found even my own staff would say, hey, we want to close 2 days for X training. We will adjust, throughout the month to make up for that difference if we can do this. And normally my answer then is yes, right? Because I have to make sure the light's down, but it's not me driving that dirty P or productivity. They know what it takes and they're able to do that. So with that, we had a nurse practitioner that come to us and said, I am mortified. My sponsoring agency just told us that our school-based health center is closing at the end of the year. She said, we're so busy and we don't know what's going on. And we started talking, and although her sponsoring org didn't ask, she asked for data. She was able to look at their workflow analysis and realize her and her front office staff person was very busy, but she wasn't able to work at the top of her license, that her Medicaid, that one of the, I don't remember if it was a HMO or one of them, were constantly denied because she wasn't credentialed, and she didn't realize she wasn't credentialed. And she was able to pull together all the pieces and come back to her sponsoring org. And once she had the data and say, here's what's happening, we're very busy, but these pieces need fixed. And I can't do it, but I can help identify. And if you will give me a medical assistant or a licensed practical nurse and let me try this for 6 months, I think I can turn this around. And guess what? We fast forward. I think Laura was on this one with me. That school-based health center is still open, and those students are still getting their services and access to services. So the old saying that you may have heard, garbage in equals garbage out, still rings true. And whenever we work with you on this, we talk about what kind of data tracking do you need for the purposes of sustainability, but also for quality improvement. So the staff can work on improving and fixing themselves, not punitive. And then that self-improvement piece. What kind of data do you need to tell that story? How can you use those numbers to show you're making a difference? Those are just some of the examples, Emily, that I think when you ask me for examples and how we work together, that I would share.
Yeah. And what I love, Paula, about what you were saying is that, and I think that this is true, this is an accurate way, I think, to characterize our work, is that our hope really is to be a support to the communities that we work with, and to cheerlead them and to offer them some perspective as they do the work, right? That we are walking alongside you and here as you need us. And that really, you know your community best. You have innovative ideas and strategies. So I love that, Paula, as an example of right, she knew that something was wrong. She had that expertise, and that you all helped her ask the right questions to be able to figure out where to go next.
Yeah. So I'm loving this conversation in the chat. So whenever you all see me looking like I'm looking away, I'm reading your chats. It's really good peer-to-peer sharing. Thank you for being actively engaged. So often we're asked, what do our consulting services look like? And we've explained, I think, thoroughly that we base those on best practices from the field. And with that, for groups who are interested in starting school-based healthcare programs all the way to school-based health centers, we offer consulting on selecting a health partner what we've touched on a little bit, whose services are conducive to sustainable school-based health care and centers. We talk about advisory groups. We have a readiness assessment, that business planning and sustainability that you heard Emily talk about, as well as planning grants for those who might come from a funder's perspective. We offer that capacity building through individualized coaching and training. Emily, do you have an example that you would like to share?
Yeah, and I know that we sort of talked about sharing this example, but I think that it's a good example of how this sometimes shakes out in real life. I'm thinking about a group that we worked with recently. Again, I say this like it's unique, but it's not. I think we always get great commitment and so much excitement and so much desire to meet the needs of children and families. And in this case, it was a school district that had approached us about wanting a school-based health center. And so we're working with them as they identified a health sponsor. And so they brought a community healthcare organization to the table to join in conversations with us and trainings and some initial planning. And that healthcare organization, a couple of months in, said, actually, this is not for us. We're going through some workforce stuff, I think, as many orgs are. And realistically, this is not a commitment we're able to make, which was disappointing. And also, I think, probably was still a value, right? So now these people know one another. They have a relationship if things change down the road. And I think that sometimes what we bring to the table is helping all of the partners understand what their roles and responsibilities are going to be. And sometimes that means that the first relationship that's built is not the right fit for this project, but that there may be other opportunities down the road. For existing school-based healthcare programs, we offer, again, personalized, continued support for improving partnerships, business practices, and high-quality practice. I'm thinking, Paula and Laura, about a group that we worked with whom we helped start a PDSA cycle monthly. So they were looking to do some improvement, and Paula and Laura have quite a bit of quality improvement experience. Do you want to share briefly about what we sort of came up with together?
So you're thinking about the Plan, Do, Study Act that we looked at around utilization. And we came in thinking that we had a robust school-based health center. And we really talked through and worked with and identified that the students, while they were there for them, if they came in, weren't actively engaged and weren't utilizing the services because the community was using the services. And we went through some PDSAs on how to increase that engagement, and as well as starting at the beginning with the consents, how you get the information out, how you gain that buy-in, how you get the consents, and then how you focus on some of the really important pieces around primary prevention. How do you make sure that they've had their well care visits, those risk assessments, depression screening if, as age appropriate, some of those national performance measures. And Emily, is that what you were kind of having in mind? Yeah. Yeah. And I think we also, even with that group, started back with some of the 101s, school-based health center 101s, to make sure the fundamental pieces were there, those core competencies that we talked about around partnerships. I know I didn't go into the details, marketing, quality improvement, that sustainability, and adolescent-friendly healthcare.
Yeah. I'm surprised, Paul, that we've been talking for so long. We really thought we were going to be brief, but I think we're both kind of fired up about this. I did see a question in the chat that I want to address now, just to really be transparent. So someone has asked about the cost for these services, which is an important question. We're going to talk a little bit more about that probably in a couple of moments as we near the end. But the short answer is that we have a number of free resources, tools, webinars available on our website, and that our consulting services have a cost. So as you listen to the rest of this, Kristen, again, I'm sure a number of people had that question as well, and I'm glad that you've asked it. We mentioned this earlier, but we support philanthropic organizations. I'm thinking, again, Laura, who is with us but not on camera, about some work that she did with a philanthropic organization, a local org that was looking to support the growth of school-based health centers in their community. And Laura was really a very involved thought partner as they developed a request for proposals, as they scored applications, conducted interviews, notified applicants. So I think that is a useful example to share because it demonstrates that sometimes we are in very close work, and then other times what people need is for us to come in and do a refresher training, and that's great too. But that if the need is for some deep work together, that we're excited and available to do that. You want to talk about state level work, Paula?
Sure. So whenever we think about state level work, we do provide coaching and technical assistance to state level stakeholders who are interested in building coalitions, grassroots movements to support and strengthen school-based healthcare in their states, including those who are interested in developing a state affiliate for school-based health alliances. And that's one of Tammy's main roles. But we start, and I think that's one of the points that I see Laura has shared around, we offer learning communities too. So it really is an opportunity. I can't help but reflect on different topics that we've done learning communities on around improvement. But Tammy also facilitates that. It's I would almost describe the state affiliate and their monthly calls and their base camp as a learning opportunity, not a true bona fide learning collaborative, but maybe it could be. If maybe I might, yeah, I don't know if that's fair, Tammy. You're welcome to kick in, but I do see so much peer-to-peer learning with the state affiliate level, that state capacity and building piece for both state affiliates and state program offices. And that comes down, we do those at the local level too, through some of that one-on-one work. Yeah.
We've touched on some of these things, but when we talk about startup support, improvement coaching, sustainability planning, that's kind of vague, right? So like, what are we actually doing during our time together? It's a handful of things. It might be assessments to get a sense of how your practice looks right now, so we can identify what's working, where you might grow, and so that you can track progress over the long term. We might work with you on a landscape analysis to help your team understand the assets and needs in your community. We do that through geomapping, applying our knowledge of the conditions that allow school-based healthcare to flourish, as well as things like site visits and key informant interviews. We've talked about trainings, which we do in person and virtually. We might facilitate stakeholder convenings. I often think about this as happening at the state level to bring the right people together to talk about priorities related to school-based healthcare. Deliverable development means that we have templates for things like year one business plans, marketing plans, pro formas, readiness assessments. We'll also create a work plan with you to help you break those big documents down into more manageable chunks. We do site visits as needed, and we will review your resources. So things like consent forms, MOUs, marketing materials. The other thing that I've not included here that I should have is coaching calls. That's one of my favorite things that we do. So it could be monthly, it could be biweekly. We'll talk about what is important for you to get out of this hour. And then we will generally work through some really concrete what's happening, what do you need, and what are the next steps, both for you all and what do you need from us. Paula, anything I've missed before I move on to the next slide?
No, I think you really covered this well. The only thing I would add is, yes, I often think of stakeholder convening also at the state level, but we do that at the local level when we're working one-on-one too, because often, as we shared earlier, it might be the education or funder side that comes that doesn't have a healthcare partner at the table yet, or it might be the healthcare partner that doesn't have a school engaged yet. So we will help identify those folks as well. That's important to have to the table at all different levels, from local all the way through the state.
Thanks, Paula. Last slide before we talk about how we might connect about working together. As we were preparing for today, Paula and I thought about what are the values that our consulting team brings to this work. And I'm sure these are not the only 4, but these were 4 that felt particularly important to highlight. We talked at the outset about how our internal team works collaboratively and how that's really important to us in working with you. We will provide some structure and support for our clients to do the work. We want you to have the capacity to do the work even after you end your engagement with us. I think about like a really good hairdresser who, when you're getting a blowout, really talks you through how to do it so that you're able to do it at home. That's our goal, is in all of our work to build your capacity. We are quite flexible with timing, with format, with the structure of the work. Again, we work to come to an understanding based on what we have seen work in other communities and the expertise that you have about your own people and community. We are action-oriented in that we work to drive clients toward action. As I said, we want to make sure you have the foundational knowledge, but we also want to make sure that at the end of our time together, things have changed, that you have moved from one place to another. And finally, we're responsive to the evolving needs of our clients. We're certainly able to repurpose our time as needed. And I think Paula does a really intentional job of inviting clients to share with us, how did that feel? Or, gosh, in that meeting, it seemed like so-and-so sort of checked out after we said this thing. What was your read of that? Really wanting to do the best work that we can together, which sometimes means having difficult conversations or changing the direction we're going, to ensure that at the end of our time together, you're closer to meeting the needs of the children and families you serve. And then Paula, I wonder if you might take this slide, and I'm just going to get kind of caught up on the chat. Is that okay?
Absolutely. So next, as we talk with you all today, we're going to talk a little bit about how to get started with working with us, but we're also going to share all of, not all, we will share and highlight some of the free resources that are available to you every day. And then we will talk about, if you're interested in a deeper level of one-on-one working together, how we would start that all the way through pricing to the end. So thank you for staying with us. And yes, Emily, I enjoy this chat so much. And but how to work with us. The first step is drop us an email at info@sbh4all.org. And we'll send an email back and request some information from you based on the needs you share with us. And we'll set up a call to talk about your needs and the budget. And then we would draft a scope of work for you to review and provide input on. And once we agree on that customizable scope of work, we would move it over to a contract, and you will get a contract to review and let us know of any changes and get the contract approved by your organization. So that's how we would do the deeper work together in the contract. But we also would identify any of the free resources we have and share those with you. There are times that folks say, hey, we can't do it right now, but we're going to work on some funding and come back whenever that's there. And then there are conversations that continue. Do you have, like I'm seeing in the chat box, a lot of consents? We have some sample consents. So that's a description of how to get started with us. The first step is just send us an email. Okay. So the next piece is we have a flyer that's available for you to take with you today. And it's also on our website because we covered a lot of information, but we want you to have it as a reference. So that's about our consulting services and flyer. And with that, we also have a lot of resources. So if you go to our website at www.sbh4all.org/resources, you will find and an opportunity to explore our blueprint, where tools, examples, guides, and resources are, including some sample consents that I've been seeing. You'll see the School-Based Health Center Clinical Performance Measure, QI, the Quality Improvement Toolkit, as well as a Sustainable Business Practice Toolkit. And within those, you'll find some versions of some of the tools that we use in consulting as well. They normally aren't the full, but enough to get you started. We have a telehealth playbook, whole section on vaccine and immunizations, Hallway to Health Toolkit, which has a lot to do with building partnerships, an oral health playbook, the mapping tool, the Children's Health and Education Mapping Tool, which you can look at to see where your existing schools are, where your existing healthcare providers are, your from the community, as well as disparities and statistics and more. I feel like I want to make sure that go to the website. There are many free resources for you. We also have a planning checklist, and there is no cost to that. It's just a high level, hey, have you thought of, here's some of the key first steps that you want to do. Thank you for putting the consulting link in the chat, Emily. And then we also have infographics. one that talks a little bit about the Alliance, and then one that has about school-based health centers and their benefits, so that as you're working with your community, you have those resources and those key points of services that they can provide, and some of the research as well available to you without having to go and look a lot. All right.
That was a lot to digest. Jean or Jean, I see your request about the checklist. I will grab that for you in a moment and link that in the chat. Oh, Paula's on it. Great.
Yep.
So Paula and I have prepared some sort of FAQs, but want to make space for your questions first. So I know that there have been a number of conversations in the chat about things like when school-based health centers are open, consents in the EHR. I encourage you to continue sharing there. But anything that you would like Paula and I, or Laura or Tammy, our colleagues who've joined as well, to answer at this time before we talk about some FAQs related to our consulting? Okay. You're, of course, welcome to continue sending in questions. But the first question, which someone sort of primed us for, is what do our services cost? And I feel like we're going to give an answer that is perhaps not as helpful as people are hoping, in that what we'll say is that we truly do work within the budget that people have. So we often, if a group says we're just seeking funding, we don't know what our budget is, we might say, here are the 4 things we think would be most important for you. And then here are 2 or 3 other things that we think could benefit your community. Or a group might say, we have this much money to work with, what's most important? And so again, we might say, for that much, here's what we would suggest prioritizing. And if things change down the road, here's the additional work we would propose doing together. So for groups who know their budget at the outset, that's really helpful information to share with us. But as Paula said earlier, we certainly work with teams who are in the exploring stages and don't know what resources are available to them yet. And we can work in those constraints as well. Someone asks in the chat, do you have resources within the provided toolkit about EB groups for serving marginalized populations with a social justice trauma-informed framework? That's a good question. And my immediate thought there is that things that have come out of our learning collaboratives, I'm thinking about the SDOH work, thinking about the adolescent relationship abuse work, that those might be some initial places if you're looking for that specific focus on trauma-informed care and on marginalized populations. Although I think much of the work of school-based health centers is about serving children and families whose health needs are not being met elsewhere due to structural barriers. Paula, what do you think to that question?
Yes, that's what I was going to say, Danica. I would like to share, especially the adolescent relationship abuse in the social determinant section of our website, and we can do that if you'll bear with it. It is on our website, Danica, but we'll try to make it easier to find if one of us can pull that here in a minute.
Mm-hmm, mm-hmm. Yeah, and I would also say that. And there's not a specific resource that's jumping out to me, but I think that our colleagues at the Adolescent Health Initiative do wonderful work with that specific lens and focus. And I would encourage other folks on the call, if there are great things that come to mind that you'd like to share in the chat, maybe from your state alliance or other partners in this work, I encourage you to do that. Paula, on a different track. Oh, thank you so much. We're working with an elementary and want to develop evidence-based meaningful groups for this age. Yeah, that's awesome. I also wonder about the National Council on Mental Wellbeing. Again, their work is big and covers a lot of areas, so there's nothing that comes to mind immediately. But thinking about behavioral health specifically, they may be another group with some resources. Paula, I'm going to kick this FAQ to you.
Yeah, I was thinking one of the next questions around for teams who work with us, who needs to be at the table for success.
Yeah, That's a good question. Jump in. But ideally, the things that we think about are someone from health. So that involves a leadership person as well as an on-the-ground person with agency. So it's great for someone at the top of that structure to be involved, but it's also really important that someone who is going to be involved in the day-to-day running of the program is involved too. And then folks from the education side. So leadership support, like an assistant principal, sometimes a superintendent joins as they're able to, as well as a school nurse and a school counselor or social worker. So again, that person who may have a lot of decision-making power at the top, as well as those people who are in the day-to-day of the health needs of children in that community. Funders are sometimes at the table. But if those people aren't at the table yet, we can work together to help you identify and build some of those relationships. Paula, 2 questions in the chat. One, which is kind of a big question. What have been some effective ways that you've seen school-based health centers work with managed care?
Oh, that's a good one.
Do you want to do that one first?
Sure.
Okay.
So, oh gosh, I'm sorry. I'm working between things.
I know, here. I'm asking a lot of you.
So there's multiple ways. The first thing I say is you have a lot in common with managed care, even though you might not think about it originally. You both are trying to figure out how to get the outcomes, meaning you want the children to be as healthy as possible and flourish at life through education and health attainment. And with that, whenever you work with managed care, there are opportunities often to work together, including some pay per performance. We've had managed care that's come in and offered some really cool incentives and some healthy rivalry across school-based health centers to see who can work to get well care visits up, and friendly competition and sharing of what's worked best so that you learn for your community. And the other ways with managed care, it's a little bit bigger, Tamara, is at the state level, working with your state Medicaid to ensure that their policies and practices are supportive of school-based health center and services, meaning that you can see students. There aren't a lot of hoops to jump through if you aren't their primary care provider, because you want students to have a primary care provider if they have one. You don't want to take that. You work with, don't replace. But of course, if they don't have one, you want to make sure that you either are their primary care provider or connect them with one, because it's a team approach. You're reducing some of the barriers to access. Other things I've seen is working with your managed care to identify those students who haven't been able to get to their primary care provider around their preventative visits and how that you can do that. And I think Tammy just chatted in the blueprint and the toolkit. I'm getting ready to share the business operation toolkit for the question that we have around how to get awareness of your school-based health center. But those are a few of the examples of working with managed care. So they're an ally if you can talk the same language and figure out what it is you both are working on together.
Thanks, Paula. Another question about the best ways to market your clinic to the community. And I think there's probably a lot of good answers here, but I will again borrow from Jane Hamilton and Chris Colheed yesterday, who talked about really being present. So at things like back to school nights or orientation, or when teachers have professional development days. Tammy, who's on the call, as I've mentioned, talks about that in some communities, the school secretary is just like a wealth of information, is someone whom families really know and trust. And so I think that partnerships are a really important piece. I think having marketing that's accessible in terms of the language you're using, the images you're showing, I think that stuff is really important too. But I think that my experience has been that strong partnerships can be the make or break there.
And I want to divert back to managed care for just a minute. I had forgotten. It reminded me, Kristen, I think you were on from Illinois. I believe you all had some success and some really high quality work that came out, a toolkit working with managed care. So that might be another resource that our colleagues in Illinois develop.
I see another, Tammy, yep. That young people can also be a really important piece of marketing. Yeah, absolutely. I see a question about how would you approach primary care providers that fear that school-based health is replacing them, even though it's a collaboration? This has come up in previous presentations this week. I think it's a timely question.
One thing I would share to that, Emily, I actually experienced this. My local pediatrician was very upset. And we sat down and had a conversation, and we both agreed we wanted what was best for the pediatrician's patients and the students at the school. And we figured out how to do that at a granular level, in that we recognized if we always come back to the student and wanting what's best and focus our conversations around that, and then work through the concerns, that the outcome meant that that student had access to care while they were at school, or working with us with their primary care provider, keeping them in school and reducing some of the barriers. One of the things we did that was very simple is whenever the pediatric practices that served as the primary care provider, those students come in, we kept a communication, and we would go back and forth, because it was very important that that continuum of care and collaboration happened. So we knew what was going on and the issues that were being encountered and the treatments that happened. And that was one example of if we can come back to the kids and what keeping the kid at the center, we can work through it with those students.
Mm-hmm. One perhaps less complex question is about how long do we work with people? And again, like the answers to many of the other sort of FAQs is that it really varies. We have a menu of services and a timeline that we suggest that sometimes works in a community. Sometimes they're hoping to do things on a more abbreviated timeline, in which case we'll try to be really clear about what's possible, or on an extended timeline. And sometimes things come up and the process gets delayed, and so we amend the contract for an additional 6 months. So we're pretty flexible about how long we work together. Anything in the chat that I've missed as we get ready to wrap up?
You know, one of the questions around, do we provide coaching for small rural community health centers applying for school-based health center grant funding? And we will provide anyone that's applying for grant funding some of the picture of school-based health centers nationwide and what that looks like. We don't normally get into grant writing. It kind of puts us in an odd position as we work with many folks, but we will provide some of that census information of school-based health centers, what that looks like, and the research behind it.
Thanks, Paula. So we're sort of nearing the end of our time together. I am so appreciative that you all joined us, and even more appreciative that many of you shared about your work and your resources in the chat. I'm just overjoyed to see people connecting in that way. Again, Paula and I and the rest of the consulting team are available if you need us. If there are any resources that we mentioned today when we were talking about all of the things on our website that you can't find, drop us a line and we'll help you find them. We would love to stay in touch and hear about your work. So please do reach out as you need us.
Okay. Thank you all. I'm going to end the stream.
It's good to be with you.